Rajkumar Singh's brother-in-law has been admitted to a COVID ward in Delhi, but it wasn't easy. He blames the government and people in positions of influence who get access to critical hospital admissions faster than people from his socio-economic background or neighborhood.
It is very difficult to get an admission in hospital. We couldn't find a free bed. For the last 4 days, we went through all the hospitals, but there was no admission anywhere. But I managed to get it at this government hospital here.
He isn't the only one, but few people we asked wanted to comment publicly. Many are also reluctant to confirm if they've had to offer bribes for a hospital admission. Bribing, or bakshish as it's referred to locally, is a common administrative practice here.
But the reality is, the big people here don't have the hassles we do. They get a good and prompt service. Common people like us don't get that.
Too often, the quality of care afforded the sick and dying comes down to class. Vikas Kansal lost his mother. She was able to get hospital admission, but died when the oxygen she needed to live was turned off. Since he couldn't visit, he got the help of a hospital assistant so he could see her via video call the night before she died.
I can say this hospital doesn't care anymore. They aren't caring towards COVID patients. Patients are all the same.
Hospitals have been operating beyond capacity for weeks. There are a total of 700,000 beds in public health institutions across India. Estimates suggest another 1.2 million beds are available in private hospitals. Combined, that's less than 2 million beds for a population of 1.3 billion. As the country battles the world's largest COVID-19 crisis, statistics show there are just 95,000 ICU beds and 48,000 ventilators available. Canada and other countries have sent aid money, antiviral drugs and badly needed ventilators. But more help is needed.
We went to about 4 to 5 hospitals there. They didn't have any oxygen cylinders. There was a lot of struggle to get one.
Rural areas are often poorly equipped, but even around the state of Delhi, people risk travelling to the capital city where there are more medical facilities to plead for access to a COVID wing.
The public health system in India already has 3 tiers, which tend to reflect the rural to urban divide. But even in cities like here in Delhi, there are pockets of migrant workers and daily wages who would not have the right connections, let alone the facilities to get admitted to a COVID ward, whether in a public or private hospital. Where this leaves people like here is a question that remains to be answered. Arabella Seebaluck, Global News, Delhi.